Elsewhere, the Ministry of Health has published a list of 8 overseas hospitals authorized and recognized by the Social Health Authority to offer specialized treatment for SHA referral cases. Health CS Aidan Duale says the overseas treatment package has been capped at 500,000 shillings and only for care that is not available locally. At the same time, SHA fraud suspect Harun Liluma was arraigned in court facing multiple counts of fraud. Liluma is charged with conspiracy to defraud, operating an unlicensed health facility, among other charges. Mary Morki reports.
After months of contestation over suspension by the Social Health Authority, the government has announced resumption of the Overseas Referral Benefits Package.
Overseas treatment scheme was a conduit for abuse.
Health CS Aidan Duale says the authority has empaneled 8 overseas facilities.
We have a list of providers where I will read out to you who are the hospitals that Kenyans can now go abroad and access services from. The process of enrolling hospitals for overseas treatment is continuous. We'll be using an SPP procedure, and so this list will continue changing as more and more providers apply. But so far, we have this 8 group of hospitals that are now going to be accessible to Kenyans next week.
SHA will only pay for overseas treatment if the procedure is not available locally.
Duale emphasized that all the empaneled overseas facilities must also have a formal linkage with a local contracted facility to ensure that when the patient returns to Kenya, there is continuity of care. Speaking during the Senate retreat in Naivasha, the CS denied claims that SHA had lost money to fraudulent claims.
There have been no loss of 11 billion from the Social Health Authority. This figure, which currently in fact has grown, currently stands at 12.7 billion as of today, represents the claims that were flagged, the claims that we rejected, and the claims that were unpaid by our digital superhighway gatekeeper. So these are money that we have saved. These are money that if NHIF was in place today and was using the manual system, this money could have been paid to providers.
Meanwhile, in Nairobi, SHA fraud suspect Harun Liluma was arraigned in court over multiple counts of SHA fraud. He and others not before the court are accused of operating health facilities without licenses. The suspect is accused of illegally accessing the KMPDC's regulatory human resource information system and creating and/or altering records therein. He is also accused of unauthorized access to the regulatory human resource information system and registering several health facilities that did not meet the statutory requirements, causing the facilities to fraudulently receive over 12 million shillings from SHA.
Alternatively, cash bail of 1 million with the 2 contact persons. The matter will be mentioned on 12th of March.
He was released on a 4 million cash bail. Mary Morki, Citizen TV.